This is the OBGYN's office. Is this where you should be? Okay, looks like a new face. It's nice to meet you. What is your name, just so I can see if you're on the schedule? Date of birth for me, please. Perfect. Thank you for coming 15 minutes early. So today it looks like it's just going to be, your first time at the gynecologist, just a routine annual exam. You look nervous. Are you nervous? Trust me, we all are. You know, it's a very sensitive specialty, very sensitive field, but we are here to educate you and to take care of you so you have the best experience that you can, okay? Perfect. Do you mind confirming your address for me? Perfect. And can I get a phone number if we need to call you? Thank you. And can I also get a pharmacy on file for you in case we need to send you a prescription? Is that the one on Allen? Yep. And all of our prescriptions are sent electronically, which is really convenient for you. Now, is there an email address that you want me to put on file so that we're able to have you sign up for the portal so you can access your test results? At Gmail. Okay. Perfect. And then we already have your insurance information on file, so it looks like you are all set. I'm going to get you checked in, and then the medical assistant will bring you back for your vitals, and we'll get you going so you can meet the provider. Absolutely. I'll have you sit in the waiting room, okay? Perfect. Hello, I'm Lee. It's nice to meet you. I'm going to be the medical assistant taking your vitals and your history, okay? Now, you are sitting in a perfect spot. So let me get your vitals first, and then we'll kind of get going on the history taking. So your first time at the gynecologist? Can definitely be nerve-wracking, but we are here to support you 100% and make you as comfortable as you can be, okay? So you are in a good spot. I'm just going to get your blood pressure, and then we'll get your temp, okay? Perfect. Any concerns today at all? Everything's just routine? Okay. And you are 23? All right, I'm going to take this and put it around your arm, okay? Does that feel okay? It's not too tight? Okay, perfect. I'm going to take a quick listen. All right, perfect blood pressure. Whoop. Let me take this off. Excellent. I'm just going to write this down real quick. Do you know how tall you are? Approximately how much you weigh? Perfect, thank you. All right, let's grab that temp. Do you go to school? Do you work? Okay, very cool, very nice. Yeah. How did you find us? How did you hear about us? Very cool. We love to hear it. So I'm going to ask you to just, this is going to go right under your tongue, okay? Yep. So as I was going to say, just open your mouth for me. Perfect. Temp is normal. All right. So, this is where it gets a little bit personal and in your business, and I totally acknowledge that, but just try to be as open and honest as you can when answering these questions, okay? Okay, let me put the thermometer away here. All right. Any medical conditions that we should be aware of? Okay. Any surgery specifically regarding uterus, ovaries, breasts? Do you smoke or drink at all, whether it's cigarettes or marijuana? Any family history of breast, ovarian, or uterine cancer? What about colon or cervical? Now, are you currently sexually active? And when you are, is it with male, female partners, both? Do you use protection? And are you on any forms of birth control, whether that be hormonal or non-hormonal? And have you ever been screened for an STI or sexually transmitted infection like gonorrhea or chlamydia? All right. Have you ever had a pap smear? They start at the age of 21 in the US. Well, if you've never been to a gynecologist, probably not. Okay. Have you ever had a speculum exam where, they call it the clampy thingy a lot on social media where speculum gets inserted to look in? Okay. I know that's the part people are most nervous for, but what I typically say, in my opinion, of course, is if you are sexually active, the speculum may feel cold and a little bit weird and uncomfy, but it should not be painful. And of course, you would verbalize that with the provider, okay? All right. So here's what we're gonna do. Since you are 23, I do want to collect a urine sample from you as long as I have your permission. It's always good to screen for things like gonorrhea and chlamydia, whether it's off the urine or off of the pap, because what people don't realize is a lot of times with sexually transmitted infections, the most common symptom is no symptom at all. You're okay leaving me a urine? Perfect. So here's what we're gonna do. You are going to go to the bathroom, leave me a urine sample in this cup, and just leave it out on the counter. And then I'm going to leave you this drape here. Now, you are going to keep your top on, but you'll take off your bra. We'll start with the breast exam, and then we're going to quickly press on your belly for a quick abdominal exam. And then you will drape this white sheet over your waist, just for privacy purposes, and then we'll end it with the pelvic exam and the pap smear that screens for cervical cancer, okay? I know it's a lot of information. We can always guide you through the way as well. So this cup is for you. There you go. Leave that urine for me, and then the provider will meet you in the exam room. Good luck. All right, thank you so much for the info, Lee. Hello, nice to meet you. My name is Leanne and I'll be performing your exam today. I understand this is your first time at the gynecologist. Definitely can be nerve-wracking, but hey, I want you to act like you've known me for 10 years. So if I ever do anything uncomfy or you're just not feeling it anymore, please verbalize that with me. Just pretend I'm your sister. Just say, hey, stop, like I can't do this, because please remember, we can never force you to do anything, okay? Now, one thing I find very beneficial is kind of showing all of the equipment before I use it. So we'll do that first. Now, for the breast exam, I'm just going to be wearing gloves, and I'm just going to make sure I don't feel any masses or lumps or see anything different. I'm going to press on your belly for the abdominal exam. And then we get to the pelvic exam. Now, in the United States, when you are 21 and above, regardless of sexual activity, you should get your first pap smear, pap test, which screens for cervical cancer. It's very important. So let me show you the equipment. So as part of the pelvic exam, of course, the way we look in the vagina to make sure everything is healthy and that your cervix looks good is we use a speculum. Now, vaginas vary in sizes and shapes. All are beautiful, so there's different speculums to kind of correlate. I will always start with the smallest speculum, okay? So you don't have to tell me that. So just to give you an idea, Speculums can be metal or plastic, so I have the metal ones here. So this is a smaller one, and this is a bit longer one, in case I can't see your cervix with the small one. What's going to happen is if this is your vaginal opening here, you'll feel some cold pressure, and then we are going to look inside of the vagina to see your cervix. Once we do that, I'm going to take these brushes here. People always joke that they look like eyebrow brushes. Let me grab this. So, 2 brushes here. Set this down. If this is your cervix, this one's going to go a little bit at the opening. Cells will be taken. And then this one that we call the spatula will wipe on the surface. And then they will both go in a specimen container. So let me take that out since we'll be using it. Now, when was the first day of your last menstrual period? Okay. And have you ever been pregnant before? Okay. Now, with that being said, it's completely okay if you get your period or you're on your period during these exams. Preferably, we prefer you not be, so it's good that you're not, but we always have these white Q-tips we can clean the area with if there's too much discharge, whether it be normal, ovulatory discharge, or any bleeding, okay? All right, let's see if I need anything else. We already got the urine from you. Perfect, perfect. All right, do you have any questions before we get started? No? All right, then let's do this, okay? You got it. All right, so the first part of this exam, as we've discussed, is the breast exam, okay? You are just going to raise your arms. Yeah, just like that. Perfect. You let me know if you get too uncomfy. Okay. Have you noticed any lumps, bumps, or anything like that? Okay. No swollen lymph nodes, which is good. And you haven't noticed discharge coming out of the nipple at all on either side? Okay. Good. All right. Breast exam is good. No masses or any abnormalities seen. I'm going to press on your belly now a little bit, okay? Okay. And you're not having any pelvic pain? Good. All right. Abdominal exam is done. Now I'm going to walk you through the whole pelvic exam, so let's get you situated here. All right, now we are almost done. The pelvic exam and PAP is the last part of this visit, okay? So you are going to feel my gloves. I'm just going to be looking on the outside to make sure I don't see any abnormal lesions, moles, anything like that, okay? All right, so you'll feel my gloves. Outside assessment is good. Now this is when we're going to do the pelvic exam, okay? Where you're going to feel the speculum. Now remember, you communicate with me if you get too uncomfortable. Again, you're going to feel my gloves down here. Perfect. Just on the outside right now. Okay, now you're going to feel the speculum. It's kind of a cold pressure, okay? Cold pressure, doing okay? Good, good. Now this is the weirdest part where we open it up. All right, you are doing so good. Locking it in place. Your cervix looks very healthy. No abnormal polyps or anything like that, okay? Let's get your PAP going. Cervix looks good visually from what I can see. You'll feel a little brush back there, or you may not. It kind of depends on the patient. Perfect. All right, last brush here. And you don't have any abnormal discharge or bleeding today, which is good. Let's mix these together. Now your pap is completely done. Went by pretty fast, right? Yeah. Now, one thing I forgot to mention. So what I'm going to do, I'm going to take the speculum out. The last part of the exam is when I insert my fingers to make sure that I don't feel any masses and that you're not tender, okay? Yep. Speculum is out. All right, but for this part, I can actually put lubricant. All right, you're gonna feel my fingers. Does that hurt? Good. Can you believe it? You completely finished your entire examination. Congratulations, you did absolutely fantastic. I'm gonna send your pap result out. I'll also send out your urine just to screen you for gonorrhea and chlamydia. But it was absolutely a pleasure to meet you, and I hope that this exam went a lot better than you anticipated. Yep, it was such a pleasure meeting you, and until next time, okay, I'll see you in 1 year. Perfect. Have a good one.